The exercises or stretches a person does to alleviate back or neck pain might be different from person to person. So it's important to figure out which exercises alleviate your pain. This will take trial and error to discover the most effective exercises. Most people with back or neck pain have what we call a directional preference. A directional preference is when the back or neck responds well to stretches or exercises done by repeatedly moving in the same direction. We refer to these movements as flexion, which is bending forward, and extension, which is bending backward. To make it easier, I'll just say forward or backward. As physical therapists, we take patients through repeated motions to see how they affect their pain. Our goal is to focus on moving in the direction that reduces and eventually eliminates pain, while then minimizing motions in the opposite direction. People typically spend much more time in their daily lives bending forward rather than backwards, picking up objects, reaching for things, hunched posture, etc. Given this, most people's directional preference will be bending backward in the opposite direction. The possible exception to this rule involves elderly patients, who often respond better to bending forward. Prone press-ups are an example of exercises for someone with a backwards directional preference. To complete a prone press-up, lie on your stomach with your hands under your shoulders. Use your arm strength to lift your chest up into the air. Keep your hips pressed to the table as you lift yourself up. Hold this for 1 second, slowly lower back down. Do these in sets of 10 repetitions. As a general rule, you should feel better after a set or two of these exercises. If you feel worse after prone press-ups, then you may be moving in the wrong direction and should try exercises in which you bend forward. Once your directional preference is established, then you establish a set of exercises and the frequency needed to reduce and eventually eliminate your pain. Some people, though, especially the older patient, won't tolerate exercises in which you bend backward, like prone press-ups. These patients may benefit from repeated motions in the opposite direction. Typically, we'll ask this group to sit on the edge of a chair with their knees shoulder-width apart and bend forward between their knees. Again, we'll start with 10 repetitions and then determine the frequency throughout the day needed to eliminate your pain. After you determine whether you benefit from exercises that focus on bending backward or forward, it's important to establish a routine with these exercises. For many people suffering from back pain, coupling directional exercises with hip stretching is very beneficial. Stretching combined with good posture and lifestyle changes like losing excess weight and quitting nicotine products can also improve your health and back or neck pain significantly. Visit www.thebackcoach.org for more information about your back health.